Welcome to Body in Balance Podcast. I am your host, Charlotte Johnson, the certified licensed physician assistant, sent here to kick some knowledge your way once a week for the purpose of educating, informing, and enlightening this audience concerning physical, spiritual, and emotional aspects of our bodies in relation to our Creator, the one, the only, the true and living God. He is the King of Kings and the Lord of Lords. Let us give it up for Yahweh. Hello. Good morning, everyone. I'm running a little behind because I'm not in my normal studio setting. And so I'm here in Phoenix, Arizona for the AIM 2025 convention with the Church of God in Christ. And I'll tell you, it is extremely hot here. I think yesterday was 113 degrees outside. So what I'm doing today is I put out a short that let you know we were going to be talking about tinnitus, and I did not want to disappoint my audience. So I did a little video, got everything set up, and technical difficulties, things weren't working like they should. So I decided I would jump on here and go ahead, redo it, because I want to make sure that there is something dropped, some content dropped on tinnitus for today. It's going to be pretty quick, and I'm not going to be showing any videos. I'm not going to be showing any anatomy, because you all in Body and Balance have been following me, and you know what's happening. You know where you can go to look at the ear anatomy that we did, that we talked about 3 weeks ago. And then we talked about sensory neural hearing loss the last episode. So that being said, we're going to talk about tinnitus. And it depends on where you're from. Some people call it tinnitus, but I like tinnitus. And tinnitus is simply the ringing in the ear that you hear, that key, that buzz, low tone buzz, or the crinkling of paper, like that. Or for those of you who are 55 and above that have gotten your AARP cards, you remember when they used to put on when you used to put on your 45s and your 33 records, and you would hear at the beginning, you would hear that. Sometimes you will hear that kind of noise in your ears, and that is an indication that there is some hearing loss, some sensory neural hearing loss. That means it would have to affect the inner ear, which is the cochlea or the acoustic nerve. The cochlea or the acoustic nerve. The cochlea is that snail-looking apparatus that I told you is in the inner ear, covered by the skull bone, and through the skull bone is an opening where the acoustic and the vestibular nerve come through and go to the temporal bone. I mean, not temporal bone, but the temporal area of your brain on the sides here where your ears are. So there's got to be some type of disconnection there. Now, once you have been exposed to loud noise, viruses, or injury, traumatic injury, or stroke or aneurysm, something that shuts off the blood supply to portions of that acoustic nerve or to the cochlea, Those are things that can damage the nerve cells, those hair cells that are within the cochlea. And if that occurs, then you start to lose the nerve, you lose hearing. And tinnitus is sort of analogous to pain. When you have pain in a joint, you know that there's most likely some arthritis developing. So the tinnitus is a sign, like pain is a sign that something is wrong. In a joint, pain indicates something's wrong in that joint. Tinnitus indicates something is wrong in your ears, within your cochlea or the nerve. So what you need to do is you need to see an audiologist, or they have, in certain states, they're called hearing institute specialists, and they are able to do a hearing test. So those people that are at Costco, Sam's Club, or some standing companies have hearing specialists, and they just do audiograms, which tell you that you have hearing loss or not. It may tell you the type of hearing loss. Usually, if there's a gap, as I discussed in the last video, the gap between the left and the right ear, or the right and the left ear, if it shows that there is some deficit in an ear, that's called asymmetry. So asymmetrical sensory neural hearing loss is an indication that you would need either an MRI, or I'm going to bring in two other types of imaging, or three other types of imaging: an MRA for magnetic resonance imaging of an artery, or an MRV, magnetic resonance imaging of a vein. So that would indicate that there's something wrong with the vascular system. If you have something called pulsatile tinnitus is where you'll hear whoosh, 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 and it's rhythmic. It's a rhythmic sound that you hear in your ear. That is something that you need to talk to your regular doctor about, or get to, if you have the type of insurance that will allow you to go straight to an ENT, otolaryngologist, or a neurotologist will let you see them, then you go straight to them and skip that step. If you have that pulsatile tinnitus that goes rhythmic with your heart, that's something different than plain tinnitus. Tinnitus is affecting just the nerve. Pulsatile tinnitus or tinnitus is affecting a vessel. Now, sometimes when that vessel is blocked, so it indicates it's a possibility that there is very high, extremely high blood pressure showing up in the brain. So there's some type of blockage. And if there is that, you have the possibility of a stroke, possibility of aneurysm. Those are the key things that you want to be screened for. So now, not all the time does it mean that there's a problem, but it does mean you need to look and make sure it's not that problem. If there is extremely high blood pressure that is in the brain, then they call that intracranial, inside the skull, inside the cranium, intracranial hypertension. So it's elevated blood pressure within the brain, the vessels in the brain. And that's something that we would be looking for if we start hearing, or you start hearing pulsatile tinnitus, that's something that we would look for. Now, sometimes we will look for it. We use an MRA or an MRV, or we may have to do a CAT scan, which is a CTA. Well, why would you use a CAT scan as opposed to an MRI? The best standard of the two, if you're looking for something at the artery, is the MRA. And then if you're looking for something in the vein, you'll use the MRV. Those are the top standards. But say you have an implant. If you have a metal, say you've been shot and you have a bullet fragment in your body, then we can't use an MRA or an MRI because that's a large magnet and it can shift that bullet fragment and you can die. So therefore, we would have to use a CTA to look for the problem that we're trying to find. All of these imaging studies would have to have contrast. We would have to use contrast to make sure that we see what we need to see. What are some other things that I want you to know that are very important? I want to bring to your attention, when you go to your provider, you want to make sure with pulsatile tinnitus and that intracranial hypertension, if you are pregnant, have been, are postpartum, if you've lost a significant amount of weight, if you've gained a significant amount of weight, if you are female, if you are in your 30s and up, these are some signs and symptoms that you need to talk to your regular doctor. If you have become chronologically matured, so you're over 60 and you're having these problems, and there's a family history of aneurysm or stroke, then you definitely want to talk to your regular doctor so you can get these imaging studies to rule that out. Now, say you rule it out and we don't find anything. The point and purpose of going to the otolaryngologist or the ENT is to make sure that it's nothing serious. Sometimes we will look and there isn't anything serious. What it is that the vessels that are inside the brain that pass by where the ear is, there's a bone layer of the skull that it can get thinned and it can thin out over time. And then you start to hear the sound of the flow of blood through the vessels. That's not a problem. Sometimes you can get referred sounds from the neck or from your heart. So if you have like a heart murmur or you have some type of cardiac issue, then you can hear that sound into the ears. We talk about this with our patients to let them know because we want to get the testing, and the testing sometimes can be expensive for some people and they don't want to get it. We look at the demographics, we look at your age, we look at those risk factors, and if you don't have those risk factors, we may not have to do anything. If your blood pressure is not elevated, we may not have to do anything. But if you are, like I said, over 60, it probably, and you have the risk factors, i.e. family problems with hypertension, family problems with strokes and aneurysms, then it may behoove you to have the testing done, to get that done. The other thing I want to share with you on this video is when you first hear those sounds, sometimes it can come and go. It could come and go. It could come and go. If it's something like that and it's been a short time, maybe it's springtime or maybe it's fall and you're starting to hear it. My suggestion to you is start using Flonase or triamcinolone or the Ringtone or budesonide. So it'd be Flonase, fluticasone, Ringtone or Nasacort. Ringtone is budesonide and Nasacort is triamcinolone. Those are all nasal steroids. Well, how does that help? Well, it doesn't make the nerve heal up, and it's not going to stop the sound, but it won't be as loud. What happens is when you put the nasal spray in, there is inflammation that goes around the opening to the eustachian tube, which is the opening to the middle ear and the inner ear. If that's swollen, it kind of congests and makes you sound kind of nasally. And now your voice changes. So the resonance in your voice changes when you have allergy symptoms and you're congested. That makes sounds in your head louder. And so you can hear them louder. I have told people I have given people those 3 medications, either fluticasone, triamcinolone, or budesonide. I've given them those nasal sprays, and then they come back and tell me, wow, after three weeks or 3 months, when I see them back, they will say, hey, the sound went away. Well, it really didn't go away. It just is not as loud and you don't hear it. When we talk about tinnitus, I hate to be the bearer of bad news, but tinnitus is not something that there's a pill or there's anything that we can fix it to make it go away. Tinnitus is tinnitus because it's damage to a nerve. And we can't fix that nerve that's inside those nerve cells that are inside the cochlea. You just can't restore them, which is the importance of protecting your hearing while you're young. Now, my audience is normally between the ages of 25 and 36. Then I have my next group is 18 to 24. That's the group I'm talking to about protect your hearing while you're young. Because if you don't, if you have earbuds and you're sitting across the room from your parents and they can repeat the words of the songs, well, they probably can't because nobody knows what is being said in these songs nowadays except the young people. But my point being, if it's that loud, you're damaging nerves. So by the time you get 45, 50 years old, you're going to hear some tinnitus. You're going to hear some ringing in your ear because you're damaging the nerves, because that sound is over 85 decibels. Anything over 85 decibels, you're damaging. Now, I would say this. Once that comes up, you can use the nasal spray. Sometimes that helps, depending on how much damage is done to that particular nerve. The other thing that you need to look out for is when it happens. These are some tips. Please listen to these tips to try to help you to control that sound, because I know it's annoying. I know it's irritating, and it basically only is going to occur when you're quiet. When you want to go sit out in the backyard and have a cup of coffee, we'll talk about that in a second, and watch the birds land and fly and that kind of thing in your backyard. You want to lay in the hammock and just swing and relax in the flowing air. Or you want to just sit in your home and just read a book. you're going to hear that noise. That low tone noise. That's when you hear it, when it's quiet. When there's a lot of noise going on or talking or throughout the day, or when you're trying to, and you'll hear it when you're trying to go to sleep sometimes. That's when you would need some white noise. That's background noise that you could put on. So you may want to get one of those ocean machines or something like that that you can put on. Don't turn it on real loud. You just turn it on so you can hear both. That helps you to deal with that noise. If there's a lot of sensory neural hearing loss, nerve hearing loss, then it would be good for you to use hearing aids that have tinnitus masking. Now, if you go to Costco's, Sam's Club, some of those freestanding hearing places, they don't have hearing aids that usually have all of the technology like that. Audiologists normally have that kind of thing where they can adjust and reprogram with the Bluetooth the tinnitus masking. But that can help if you're having a lot of tinnitus. The other thing that we need to watch out for is the amount of caffeine that you intake. I hate to be the bearer of bad news for you people that are Starbucks kings and queens that love those mocha chocolate tatas, Frito Lady Mama Lies, those things with the extra cinnamon and throw a cherry on top with a couple of nutmeg and hazelnut. I don't know anything about Starbucks. I don't really go. I don't have those. But I'm saying those high caffeine espressos and all that kind of stuff, that will trigger tinnitus. Caffeine stimulates the nerves. And when it stimulates the nerves, it makes them move constantly and they make the sound. The other thing that will increase that is NSAIDs. NSAIDs. NSAIDs are non-steroidal anti-inflammatories. That's Motrin, Aleve, naproxen, Goody powder, those type things. You have to watch out if you're taking a lot of those. Even aspirin. When you look on the bottle, if you look in a very fine print, it says it may cause tinnitus on bottles of aspirin. So you'll want to look out for that. The other thing is, I'm here at the AIM convention, and when you go into a lot of the settings where the services are and they're playing the music and it's really loud, when I go, I take me some tissue and roll it up and I twist it and put it inside my ear during praise and worship because I don't want to lose my hearing. I don't want to hear tinnitus. And that can occur when you're in loud noise settings like that. If you have tinnitus, then it would behoove you to either put some tissue in your ears or purchase some earplugs. Put those earplugs in during the praise and worship area, when the noise is the loudest, so that you don't stimulate the tinnitus. And you can get the small ones. Now, I don't like the silicone plugs that they use. They're too easy to break off and go into the ear canal. And then you got to go and get somebody in ENT to dig that out. That's not cool. But those are the regular plugs are helpful. I've showed them on video. I think the last two videos, the conductive and the sensory neural hearing loss, what they look like, they're earplugs. Now, those are the tips that I would like you to know about. It's important to understand because in conclusion, I'm going to wrap it up here. I want you to, one, watch the caffeine intake, watch your NSAID, and watch your watch your sound levels, noise levels. Watch your intake for caffeine. Watch your intake for NSAIDs, Motrin, Aleve, naproxen, goody powder, or aspirins. And also watch your noise levels. The next thing I want you to remember, let me give you this. This is a really good, helpful thing for you. There's something called biofeedback. Biofeedback. Biofeedback is where what you do is you take 30 minutes, 3 days a week, and you listen to music of your whatever you like. It doesn't matter what genre it is, but you listen to music. So you put your earbuds in and you wait, get in a quiet area, relaxed area, get in your recliner, a chair, get in bed, you can get in a hammock, whatever you want to do, but you need to take 30 minutes, 3 days a week, 4 days a week if you can, relax, listen to the sound, that tinnitus, and then you turn the music up just where you can hear both of them. You don't want to inundate the tinnitus with the music. They have to be on the same frequency, because what you're doing is retraining your brain not to hear the annoying sound. So you listen to a more pleasant sound at the same time. And if you do this 3 to 4 days per week, at least 3 months, it takes a little while for it to get better, but at least 3 months, what you do is retrain the brain not to hear that sound. Think about this. Go into your kitchen and stand there, close your eyes, and listen intently for the refrigerator. And you'll hear the quiet hum of the refrigerator. How many times have you been in that kitchen and you've not heard the refrigerator? It's not like it's not been going. You just weren't paying attention to it. You didn't care. You don't care that the refrigerator sound is there unless it's not there and your food isn't being cold. So that's what you're doing, is retraining your brain not to hear that sound. You can try that as a relief from the tinnitus, because like I said, there is no cure for tinnitus. If you hear pulsatile tinnitus, rhythmic sound, that you want to be sure and see your otolaryngologist and see a hearing aid specialist or an audiologist. You want to see them because you've got to get a hearing test to see if there's loss. Then you need to get an MRI, MRA, or MRV. You need the MRA or MRV if there's a problem with vascular issues. You need the MRI if there's a problem with asymmetry. So regular tinnitus goes with the MRI. Pulsatile tinnitus, you need something that looks at the vessels to make sure there's no obstruction. And that is the MRA or the MRV. If you hear the pulsing constantly, and you can take your 3 fingers and press on the artery close behind your ear, and it goes away, you would need the MRA. If it's constant, then you'd need the MRV. That's not something you have to worry about. Your regular doctor will evaluate you. Your otolaryngologist will evaluate you, and they'll make sure that you get the right test. This is the information that I wanted to give you this week. I didn't want you to be without a video while I'm here at the AIM convention. So hopefully this information will be a blessing to you or someone in your family. And unfortunately, I didn't have any great news to say that the tinnitus is going to go away, or there's a tip to make it constantly go away. Those things with the nasal spray and the biofeedback may be very helpful, along with cutting back on some of your caffeine and the NSAIDs. You can switch out your NSAID with Tylenol, and that may help with the ringing if you're getting inundated with those NSAIDs. So for now, I look forward to seeing you next week. I want you to like and follow on my Facebook page, and I'd love for you to be a subscriber so that as soon as I drop, you'll be able to have the information. Until next week, see you then. Hopefully, your horizons have been enlightening.